What is going on, future nurses and nurses? Cordero here.
Monica.
And today we are going to be talking about what's the difference between our two nursing programs. So we've got a couple of questions talking about asking what's the difference between my online program and Monica's more traditional program that she goes to. So we're going to be digging into that a little bit. But before we do that, if you haven't commented, liked, or subscribed, go ahead and do that now. We're doing our best to produce the best content that you can apply to your nursing journey. So let's dive into it. Monica, what do you like best about your traditional program?
I like that it's quick-paced. There are other programs out there that are less than 2 years, but I do like how it's 8 weeks, semesters, or classes essentially. And so as soon as you finish that last final, like on Wednesday for instance, then you're going to be taking a brand new class on Monday. So they always keep the ball rolling, and I really like that because I get bored easily. I can't be in a traditional class for 16 weeks. It really kills me. And I like how we have a lot of easy access to our professors. Like if I have a question, I can really march into the to the office and make a call and schedule an appointment and XYZ. But I like that instead of like having to, like for him, it's so hard for him to reach his professors, so I really like that I have easier access. And then I also love that we have our own simulation center, and it's super nice. We can go there and practice whenever we want, and it's just right on campus, so everything's kind of just in a huge bubble for us.
Cool. Well, with WGU, kind of how they do their simulations. So we had some of our simulations that were done through the computer. So we have like a virtual patient, and we're taking care of this patient virtually. But also we partnered up with a community college out here, and so we can also go to the community college and practice on their dummies, but it's not our own and it's not state of the art, more like her program is. But I also like about WGU is that we have the ability to control our learning in a sense. So if work kind of gets heavy, you can kind of schedule your studying around it that way. And I also like that you can get to the program a little bit easier than some other nursing programs. Since they do require that you have at least an associate's degree, they're kind of eliminating a lot of people that are already applying to nursing school. Our program is pretty much structured for people that are in the middle of a career change. So they've already been in the workforce for a little bit, they already have a degree, but are ready to change. So it's really more tailored to what I need. So what do you dislike?
Sometimes I wish that I was in an online program, because I have taken some online classes with my program, and it was a lot more easy to control my life. Like he said, he gets to work full time. He gets to manage his own curriculum pretty much when he wants to study, when he wants to take his test. And that's what I do miss about online classes, because there are really good teachers out there, and then there are not so great teachers out there, that sometimes reading off a PowerPoint is something that I can do at my own home, and it's just kind of a hassle to be in traffic for almost an hour, get to class, and then somebody's basically doing something up there, which they're doing a good job at it, but I could also be doing that at home and just reach out to the professor if I had any questions. So that makes it a little bit cringy for me, because I do like online classes and I do like to work on my own time like he does, and I like to manage my own time, and it's really hard to whenever you have to be in school twice a week on top of clinicals. But now they made a huge change to the Irving campus that they're going to be scheduling classes that used to be twice a week now for once a week. So they're going to be 5-hour classes, and I'm so stoked about that, because 5 hours sounds like a lot, but look, I can still schedule my work days, make good money, and miss out on Saturday money. That's fine, but I can still only go to campus once a week on top of simulation days, instead of it basically adding up to almost 4 times a week whenever we do have simulation days. So I really love it, and I'm kind of sad that it didn't start when I first started in the program, but hey, 6 months to go, can't really complain.
So what some things that I feel about WGU that not WGU but online nursing programs that make me feel some type of way is sometimes they throw so many resources at you that it can get confusing, because they kind of want to cater to the audible learner, they want to cater to the visual learner, they want to cater to all these kind of learners. So you have all these resources to learn a thing, and it's like you can kind of be overwhelmed from which one do you need to be reading. Should I watch the video? Should I look at the PowerPoint? Do I need to be reading this link? It can kind of get confusing. And at that same level, something that's kind of hard with being online is that we don't actually go and lecture. So you don't get that person-to-person connection with your professor, kind of like she gets. You know, she's been able to develop a lot of great relationships at her school, when my relationships are more or less over the phone with the professor. But I mean, you know, we're still getting through it, so it's not too bad.
Yeah, I can see how that could be troubling, because if you're in class, the one thing I do like about it, if somebody's teaching something, I'm like, oh, hey, like, I don't understand this concept, can you teach it to me? Whereas
you learn from each other.
He's at home and he's having to like dig through the web, dig through his like 150 resources, and I can see how that can be very frustrating. Whereas when we're in class, they kind of just tell you, hey, use this book, use this right here, and just focus on this because we're going to be getting our test questions from this book, not from anywhere else. So it does make it a little bit easier, I will say.
And especially for you guys that like to study like in groups or with people, it's a lot tougher for online.
Yeah.
Just because you don't really know where everybody's at. You know, like at least whenever she goes to school, like everybody knows, okay, we're on this part of the chapter or we're on this part of the program. Because we kind of control our learning, I may be 2 weeks ahead or 2 weeks behind somebody else that I'm trying to study with. I've tried it early on and it was just, people learn at their different paces.
And it's weird too, because for your school, there's a lot of people coming from different parts of Texas because it is an online program. So I think that's a little bit of a con for you as well that I've seen you struggle with. And y'all's clinicals, isn't that another thing that...
So our clinicals, they were kind of weird at first.
They're far.
Yeah, my clinicals were about an hour away. But as our campus continues to grow online, they're making a lot more closer to where we're at. It just with my cohort, they were a little bit further because we were behind, but you know, it's whatever.
Makes sense.
But that's really the big difference is nursing school is still hard. You know, mine's not more easy or more hard than hers. I think it really has to do a lot with the professors and how much you speak with the professors, because you have to know that they are your resource. They are there to help you. They're supposed to be there to help you.
They're supposed to be there to help you.
They're supposed to be there to help you, because I
yes.
get into that. We both had ATI too, so we both had to study for ATI tests, so that's one thing that was the same about them. And pretty much the structure is the same too. So she's in critical care now, and then she goes into psych. I was in psych probably about a semester and a half ago. So the, what's the word I'm looking for? The schedule, the itinerary, the way the classes are structured throughout your program can differ. And that's with any nursing school, whether it's online or not.
But for mine, the only reason I'm taking psych right after critical care, which I know a lot of you are probably like, what the heck, that's really weird, is because when I went to Africa, they had to rotate my classes around in order for me to be considered as a full-time student for FAFSA. So that's why I'm taking psych last before I get into collaborative and capstone. So it's going to be really weird because I'm a senior right now and I'm going to be with a bunch of freshmen. And this is going to be like my third cohort that I've, worked with because of all the transitioning because of the Africa trip. So it's pretty nice. So get to meet some cool people.
Yeah, if you haven't seen our Africa video, check it out.
Definitely check it out.
It's super
awesome
dope.
Experience.
The pictures are fresh as hell. Like, I'm so jealous. But that's really it. We're going to keep the video short and sweet. If this video helped you at all, be sure to comment nurses rock in the bottom, and we will talk to you guys next time. Peace out.